Hi, and welcome back to my channel, Learning Biology with Dr. Vanessa, where I take difficult biological concepts and make them easy to understand. Did you know that the adult human skeleton consists of 206 bones, but at birth we have closer to 300 bones? That's because many of the bones as a baby are actually separate pieces that allow for growth and flexibility, especially in the skull and spine. As we grow, these bones gradually fuse together, forming the strong, supportive skeleton we rely on throughout adulthood. The bones of the skeleton are grouped into two divisions: the axial skeleton, which forms the central framework of the body, and the appendicular skeleton, which includes the limbs and girdles that attach the appendicular skeleton to the axial skeleton. In today's video, we're going to focus on the axial skeleton, the part that supports and protects your brain, spinal cord, and vital organs. We'll cover the major bones of the axial skeleton and how they work together to give your body structure and stability. The axial skeleton forms the central axis of the body, hence the name axial. Think of it as the core scaffold that everything else attaches to. It includes the skull, the vertebral column, the thoracic cage, and the hyoid bone. Altogether, the axial skeleton contains 80 bones. That's about 40% of all the bones in your body. Let's start at the top. The skull is made up of 22 bones, grouped into two main categories. Cranial bones, there are 8 of these that form the cranium, which encases and protects the brain. And then facial bones, there are 14 of these that shape the face, house the teeth, and form part of the nasal and orbital cavities. Let's look more closely at those 8 cranial bones. Those cranial bones include the frontal bone, which is the forehead, 2 parietal bones, which we find on the top sides of the skull, 2 temporal bones that are found on either side around the ears, the occipital bone in the back of the skull, the sphenoid bone, which forms part of the base and sides of the skull, and then the ethmoid bone, which is deep in the nasal cavity and between the eyes. These bones are joined by sutures, immovable joints that fuse as we age. Facial bones include the 2 maxillae, 2 nasal bones, 2 zygomatic bones, the mandible, 2 lacrimal bones, 2 palatine bones, 2 inferior nasal concave bones, and vomer. The mandible is unique. It's the only movable bone of the skull and forms the lower jaw. Also important is that besides that large cranial cavity where the brain resides, the skull also has smaller cavities. This includes the nasal cavity and the orbits or eye sockets. In addition to these, some bones also contain paranasal sinuses. These are air-filled spaces that help lighten the weight of the skull and contribute to the resonance of your voice. These are usually air-filled, as I just mentioned. When you get a sinus infection, they do fill with mucus because these air-filled sacs are lined with mucous membranes. When they fill with mucus, your head does feel heavy at that point. Let's talk a little bit more about the sutures of the skull. The sutures are immovable joints that are found only between skull bones. They're made of dense fibrous connective tissue, and their purpose is to fuse the bones of the skull together. The major sutures include the coronal suture, which connects the frontal bone to the parietal bones, and it runs across the top of the skull like a crown. The sagittal suture, which connects the 2 parietal bones, and it runs along the midline from front to back. The lambdoid suture, which connects the occipital bone to the parietal bones, and it is shaped like the Greek letter lambda across the back of the skull. And then there's the squamous suture, which connects the temporal bones to the parietal bones, located on the lateral sides of the skull. These sutures play a crucial role in maintaining skull integrity, but they weren't always fully formed. In infants, the skull bones are not fully fused. Instead, they're connected by soft spots called fontanelles. These fontanelles are really important because they facilitate childbirth. The flexibility of these areas allow the skull bones to slightly overlap as the baby passes through the birth canal, a process that is called molding. The other thing that these fontanelles do is allow for brain growth. The brain grows very rapidly during infancy and childhood, and these flexible areas accommodate the expansion without restricting the skull. At birth, there are actually 6 fontanelles, but the 2 most prominent are the anterior fontanelle at the top of the head and the posterior fontanelle at the back. As the child grows, these fontanelles gradually close and are then replaced by immovable sutures that we see in the adult skull. So the sutures of the adult skull are actually the remnants of these early soft spots or the complete ossification of these areas, transformed over time into strong fibrous joints that protect the brain throughout life. Just below the skull sits a small U-shaped bone called the hyoid. The hyoid is the only bone in the body that doesn't articulate directly with another bone. It's anchored by ligaments and muscles and provides an attachment point for tongue muscles, which are critical for speech and swallowing. It also stabilizes the larynx and supports the airway. Now we move down the axis to the vertebral column, which is commonly known as the spine. It is made up of 33 vertebrae in total, but only 26 are considered bones in the adult skeleton because some fused together during development. Here's the breakdown. There are 7 cervical vertebrae, we see these in the neck, 12 thoracic vertebrae, which is the upper back, each attached to a rib, 5 lumbar vertebrae, the lower back, 1 sacrum, which is made of 5 fused vertebrae, and 1 coccyx, which is made of 4 fused vertebrae forming the tailbone. Some key features of the vertebral column include the curves. These curves give the spine strength, flexibility, and shock absorption. Adults have 4 spinal curves: cervical, thoracic, lumbar, and sacral. The invertebral discs. These are found between each vertebrae, except between the atlas and axis, and these are fibrocartilage pads that act as shock absorbers and allow slight movements. And then there's the vertebral foramen, which forms the vertebral canal, and this is going to be the area where the spinal cord passes through. Now, a couple of things we can talk about that is very interesting about the vertebral column is that at the very top we have C1 and C2. So C1 is referred to as the atlas, and C2 right underneath it is referred to as the axis. These are the top 2 cervical vertebrae, and they are specialized for supporting and rotating the head. The atlas, or C1, holds up the skull like the mythical figure it's named after. It forms the joint with the occipital bone of the skull and allows you to nod your head yes. The axis, or C2, sits just below the atlas and has a vertical projection called the dens, or odontoid process. This acts as a pivot, allowing you to rotate your head from side to side to say no. So together, the atlas and the axis form a pivoting system that gives your neck its remarkable range of motion, something no other region of the spine can do. The thoracic cage, also called the rib cage, protects the heart and lungs, supports breathing, and helps anchor muscles of the upper body. It includes the sternum, 12 pairs of ribs, and the thoracic vertebrae, which the ribs attach to. Let's take a closer look at the ribs. Ribs 1 through 7 attach directly to the sternum via costal cartilage. These are referred to as true ribs because of their direct attachment. The next ribs, 8 through 12, are referred to as false ribs because they either attach indirectly or not at all to the sternum. And the last two of those false ribs, 11 and 12, are also floating ribs because they don't attach to the sternum at all and offer protection to organs like the kidneys. The sternum itself has three parts: the manubrium, which is the superior or top portion, the body, which is the middle and largest part of the sternum, and then the smallest and inferior part at the bottom, which is referred to as the xiphoid process. This portion actually remains cartilage into adulthood and then later ossifies. This cage-like structure not only protects the cardiopulmonary organs, the heart and lungs, but it also expands and contracts during respiration. Let's step back and connect the dots. The axial skeleton forms the structural and protective core of your body. It allows you to hold your head up, breathe efficiently, protect your brain and vital organs, stand upright with posture. Clinically, disorders like scoliosis, herniated discs, skull fractures, and rib fractures all involve axial bones. So let's summarize the axial skeleton. The axial skeleton is 80 bones that make up the central axis of your body. It includes the skull, hyoid, vertebral column, and thoracic cage. Functions include support, protection, muscle attachment, and blood formation, and it integrates closely with all major systems, from the nervous to the respiratory and circulatory systems. Let's have a quick review and see what you've learned from this video. The first question is, how many bones are in the adult axial skeleton? Did you say 80? If you said 80, then you were right. Which vertebra allows you to nod yes? Which one allows you to shake your head no? If you said the atlas or C1 allows you to nod your head yes, you are correct. And axis or C2 allows you to shake your head from side to side to say no, then you are correct. What types of ribs are ribs 8 through 10? If you said false ribs, then you are correct. And we'll do one more. What's the only bone in the body that doesn't articulate with another bone? If you said hyoid bone, then you are right. Thanks for joining me in this overview of the axial skeleton. If you found this video helpful, make sure to give it a like and share it with your friends. And don't forget to subscribe and allow notifications so that you never miss out on new content. Thanks again for watching, and I'll see you in the next video, where we will continue this talk on the skeleton by looking more closely at the appendicular skeleton.